of that. He says he's not supporting the chairman's plan because, in his words, it's too expensive. Let's talk with Senator Richard Burr, a Republican from North Carolina, who sits on the Health, Education, Labor, and Pensions Committee. What is it that you don't like about the Baucus bill as put forward?
Well, John, specifically, he takes from Medicare almost $500 billion from a health care system that, by the trustees' own accounts, will be insolvent in 2017. He expands the roles of Medicaid, which is the health insurance that low-income Americans receive in their state, that reimburses health care providers at 72 cents of every dollar of cost in the system. All we've done is exacerbate the cost shift from one side of the ledger to the side of the ledger that either is insured or pays out of pocket. But at the end of the day, for anybody insured, for anybody that's covered, they haven't bent the curve, the cost curve on health care one bit. All they've done is shifted the pocket that they pay from it and in many cases, that's the pocket of the American people.
Well, obviously, Americans have a lot of concerns about what's going to happen to their health care in the future. One of the key issues seems to be whether you'll be able to keep your insurance plan if you have one now and you like it, and secondly, whether you are able to keep your doctor. The president goes out of his way to assure Americans that both of those things will remain unchanged. Do you agree?
Well, John, if you put more people in a capacity that they're only going to be reimbursed at 72 cents of every dollar of services provided, you're going to have less doctors that want to see those patients. More importantly, I think that you've got to understand that in our system, the ability to cover the majority of America is absolutely essential. And no plan currently considered or passed in either the House or the Senate accomplishes that. So the cost shift continues, and it means that the cost increases for the American people, for American business, is going to continue to rise.
Senate Majority Leader Harry Reid spoke this morning, just within the last couple of hours, in fact, and basically warned Republicans that they should not try to block this health care reform plan because, as he put it, he can always use reconciliation, the so-called nuclear option, the procedure that would allow Democrats to pass health care reform their way without Republican votes. Is that possible? I mean, do you believe that threat? And secondly, what do you think would happen if he carried through with it?
Oh, sure. John, I don't think it's a threat. I think that's what Harry Reid intends to do. I think the one miscalculation that Senator Reid makes is that the American people aren't watching and that they don't care. Health care has been very personal for every American, and I think that's what triggered the large outrage that we saw throughout August. That hadn't subsided. It's still there. They're trying to let the Congress go through with the process. But if Senator Reid chooses to shortcut what I think is a historical protection that we need to make sure exists, and that's that policy is not considered unless 60 senators agree. That would be a grave mistake for this bill, but also for the future of the United States Senate and for the legislation we consider.
Senator Richard Burr, Republican of North Carolina. Thanks.
Thank you, John.